While hospitals have been inundated with COVID-19 patients over the past month, they have seen a drastic decrease in emergency room visits for other reasons, other ailments, which begs the question, where did all the other patients go? News 8's Sierra Hignite joins us now live to explain. Sierra.
Yeah, Brooke, before the pandemic, it wouldn't be unusual to walk into any hospital across Indianapolis and see the room filled with patients both with and without serious ailments. But now the people and the amount of people who are coming into hospital doors has drastically changed across the country. Over the last 4 to 6 weeks, hospitals have seen a major decrease in non-COVID patients.
In many parts of the country, including here locally, we've seen emergency department visits drop by as much as 50%.
Part of the decrease is patients who would normally go to the emergency room for non-emergent needs who are now following up virtually with a primary care provider or just staying at home. But there is a population of patients who are not coming to the hospital that should.
Unfortunately, I think what we are also experiencing is people delaying coming to the emergency department in true emergencies, and in many cases having, poor or potentially tragic outcomes.
As the traditional patient numbers drop, hospitals are seeing an increase in people dying at home from serious issues that would normally send someone to the ER.
Chest pain or severe headache, vision changes, some sort of weakness on one side or the other. Any of those types of symptoms, those do warrant coming in to be seen.
There is something to be said for the change in lifestyle that the stay-at-home order has forced people into that could also be affecting the number of hospital visits.
Different levels of stress, different levels of exertion potentially, because there aren't as many people out in their vehicles and there's not quite as much of the types of things that would lead to those severe traumas.
So are people avoiding the hospital because of fear or a misunderstanding of what the stay-at-home order means?
Listen to your body. Don't ignore some of those types of symptoms.
Now, even in hospitals locally in Indianapolis, still between 40 and 60% of the patients in the ICU are not COVID related. Now, if you ever are experiencing a true emergency, you're still encouraged to either call 911 or go to the nearest hospital. Reporting in Indianapolis, I'm Sierra Hignite, Wish TV, wishtv.com, and follow us on Facebook.
All right, Sierra, thank you so much. Our coronavirus coverage continues online. There at the top of the homepage, you'll find a banner linking you to all of our stories. You can also watch all of Governor Holcomb's news conference. There's also an interactive map tracking cases across the world. It's all at wishtv.com.